Hello and welcome to Unmuted. I'm Judge E.J. Russell, and here at Unmuted we want to make sure that you are educated and informed on the issues that are affecting our community. Unmuted will feature a variety of guests, including politicians, community leaders, entertainers, decision makers, and others addressing news-breaking issues and compelling concerns to the community and nation. Today, I'm going to unmute myself, and we're going to talk a little bit about some of those pressing issues and concerns. If you would like to contact us, please send an email to unmuted@myyahoo.com. That's unmuted@myyahoo.com. I will begin our session today by talking a little bit about where we are in the legislative process. Since there's a whole lot of noise going on in the state capitol, we're getting close to the end of the session, which will sine die or come to an end on April 1. Chances are the legislators may go home before then. In my opinion, the one thing that may keep them there until sine die will be fully funding education. That's one of those things that came up at the end of February, and it took a lot of people by surprise that the legislature really wanted to come up with the money to fully fund education, which has only been fully funded twice in over a couple of decades. We are on day 73 of the legislative session out of 90 days. Today is the deadline to dispose of motions to reconsider appropriations and revenue bills originating in the other house. And what that means is if you are in the Senate, you will be addressing House bills. If you are in the House, you will be addressing Senate bills. So that is what will be happening there today, and there's also a deadline for the introduction of local and private legislation at this time. And those are bills that are specific to a specific local government and private bills. So that's where they are. They've only got a few more days to work on bills to try to resolve any differences for those bills that will be referred to conference. So a lot of things happen this time in the session. There's probably a deadline every other day, and sometimes there are deadlines back to back to back to back. But that's the way the legislative process is designed, and they are working toward that end. But one of the most important things that has come out of this legislative session is the postpartum Medicaid expansion or extension. Some people don't like to use the word expansion because it has been attributed a negative connotation. So we want to talk about why that bill was important and how we got to where we are. Because the Senate has passed that bill that would have extended postpartum Medicaid care and services for mothers and babies up to a year versus where we are currently, which is 2 months. 2 months after birth, and they lose that coverage and access to medical care. But I just want to share with you so you'll have the full facts of why this was so important. Now, maternal deaths surged nearly 40% during the second year of the pandemic. It widened disparities as Black women again faced alarmingly high disproportionate rates, a new federal analysis shows. In 2021, there were about 33 maternal deaths per 100,000 live births, a 38% increase from the year before, according to the report released Thursday from the National Center for Health Statistics at the Centers for Disease Control and Prevention. Now, the experts say that COVID-19 likely contributed to the increase, but that the sobering rates continue to reveal deep flaws in health systems such as structured racism and implicit bias, communities lost during that period of time, and continuing to decline. A roughly 40% increase in preventable deaths compared to a year prior is stunning news, according to Dr. Ifat Abbasi Hoskins, president of the American College of Obstetrics and Gynecologists. The rates send a resounding message that maternal health and evidence-based efforts to eliminate racial inequities must remain at the forefront of public health priorities, according to Hoskins. Now, more than 80%, listen to this, y'all, more than 80% of maternal deaths are preventable. Most maternal deaths, which happen during pregnancy, during labor, or within 42 days of birth, according to the CDC, are preventable. The United States maternal death rate continues to be higher than any other wealthy developed countries. And the new data shows a roughly 60% increase in overall rates in 2021 from 2019, the year before the start of the pandemic. This is quite devastating, said maternal health scholar Nyamaka Amuta Anukaga, founding director of the Tufts University Center for Black Maternal Health and Reproductive Justice. This is more lives broken. This is more lives shattered, more lives lost. This is more lives destroyed for something that is preventable. Inequities are increasing, not decreasing. In total, 1,205 women died of maternal causes in 2021, an increase from 861 in 2020 and 754 in 2019. Maternal death rates among all racial groups saw statistically significant increases, according to this analysis. But Black women again saw the highest rate at almost 70 deaths per 100,000 births, up from about 55 in 2020. White women's rates also saw concerning increase, jumping from 19 to 26.6 deaths per 100,000 in 2021. Now, Hispanic women's rates surged from about 18 to 28 deaths per 100,000. But prior to the pandemic, Hispanic women had lower rates than white women. While Black women gave birth less in 2021 compared to 2020, they died at a higher rate. That inverse relationship really underscores the enormity of the problem, said Anukaga, noting rates could be underestimated even further due to flaws in death certificate reporting and backlogging in data collection. You're seeing the highest rate of deaths in a smaller population, and the inequities are increasing. The analysis also found the risk of women aged 40 and older was almost 7 times higher than those among women younger than 25. And that is alarming on another scale from an overall cultural standpoint, because so many women are waiting longer to get married and longer to have children. So many times they'll hit that 40 mark during this time, just simply because of the cultural shift in marriage and having children. Pregnant women are more vulnerable to COVID-19, and the virus can contribute to severe complications in pregnancies. All this comes from the CDC. While we are still working to better understand the drivers of this increase, we know that pregnant or recently pregnant persons are more likely to get severely ill from COVID-19 compared to people who are not pregnant, said Dr. Wanda Barfield, director of the CDC's Division of Reproductive Health. A report from the U.S. Government Accountability Office last year found COVID-19 contributed to about 25% of maternal deaths. The pandemic has brought in a pathophysiological issue that puts those women more at risk, said Dr. Rosada Torres, obstetrician and gynecologist at Chesapeake Regional Medical Center and site director of OB Hospitalist Group. Preeclampsia risk, for example, increases when a patient has COVID-19. Barfield said other factors at play also include chronic conditions like diabetes and hypertension, for example, during pregnancy, access to quality care during and after pregnancy, and structural racism and implicit bias contributes to that. We're going to talk about a report showing disparities. We'll be right back after this break.
Welcome to the JMMF's Culinary Kitchen in partnership with Footprint Farms, and funded in part by the W.K. Kellogg Foundation, sponsored by Humana. I am Chef Shishi, the owner of Just in Time, the featured chef of the JMMF Culinary Kitchen, where we prepare farm-to-fork-centered, healthier, all-natural foods in the urban community. Our menu includes salads made from collards, kale, and spring mix varieties, fresh vegetarian soups, and fresh juice elixirs made daily. We're open Tuesday through Friday from 11 a.m. until 2 p.m. And remember, what you put in your body is just as important as what you put on your body. We look forward to seeing you soon.
Welcome back. And we were talking about reports showing that disparities persist even when accounting for education or income when we come to pregnancy health at this time, reflecting potential bias in care. For example, Black women with college education still died at higher rates than white women with the same education level. Research has also found Black babies are more likely to survive when cared for by Black doctors. What's wrong with that statement that a study found? Now, Dr. Veronica Gillespie-Bell, Senior Site Lead of Women's Services at Ochsner, Kenner, Louisiana, said systems need to prioritize equity and implement evidence-based practices, such as patient safety strategies from the Alliance of Innovation on Maternal Health. We must also think about the different areas within the health system that our patients enter care throughout pregnancy and the postpartum period, including the emergency room, she said. Improving access to care, Gillespie-Bell said, cannot be limited to our birthing facilities. Maternity care is disappearing. Did y'all hear that? Maternity care is disappearing, and the continued increase in deaths underscores the nation's crisis of disappearing maternal health care because women are still having babies. Half of the nation's rural counties have no obstetric care or OB/GYN practitioner. For example, researchers found Black communities are more likely to lose their obstetrics units. About 2 million rural women of childbearing age live at least 25 miles away from a labor and delivery unit. Some urban communities are also losing their labor and delivery units. These maternity care deserts are very problematic because that means people have to travel farther to get care. People have to wait longer for appointment times. There's a depleting of resources, of infrastructure in Black and brown spaces where we already seeing more increased likelihood of prevalence of chronic conditions. The disappearing care, coupled with the pandemic, exacerbates the problem for people who are already at high risk, said Rosada Torres. Women are being isolated from the care that they need, for sure. And that brings me to, I just wanted to highlight just how important it is to have postpartum care. And in Mississippi, it was a big debate. It's been back and forth and back and forth. And finally, the legislature this year passed a postpartum Medicaid expansion bill so that it could extend for 12 months at least, beyond now what is now the 2-month period. And postpartum Medicaid extension will increase health coverage for new, poor mothers from 2 months to 12 months. It's a common sense deal passed by a dozen other states that would tremendously help mothers and kids in Mississippi, which boasts one of the highest maternal mortality rates and the highest infant mortality rate in the nation. But yet we want to fight about whether it's a good idea or not. And it would cost the state just a meager $7 million per year. $7 million a year, which is a drop in the bucket given the current $3.9 billion surplus that Governor Reed often wants to boast about. Mississippi moms can't wait, said countless physicians, nurses, mothers, children, and everyday Mississippians that have all but gotten down on their knees and begged for the Mississippi legislature to do something. Now, until maybe last week, might have been the end of the week before, when Governor Reed finally said, well, if the legislature sends it to my desk, I'll sign it. I checked yesterday, and it did not show that he has signed it yet, even though the legislature has sent him that bill. Now, what is postpartum Medicaid extension exactly, and how will it help with some of those awful statistics I just got through talking about on maternal health? Postpartum Medicaid extension is proposed or legislation which has been sent to the governor to extend, once again, the length of health care coverage for Mississippians on Medicaid who give birth. Postpartum visits can include care of chronic health conditions, once again, like that diabetes, like that hypertension, which causes so many problems in pregnancies if they are already present. Mental health issues that might arise after giving birth, such as postpartum depression, which may become an even greater concern and issue since, of course, abortions are illegal now in the state of Mississippi. So if someone is going to have a child that perhaps they would not have otherwise given birth to, then the depression may slip in. Federal law mandates that states provide postpartum Medicaid coverage for at least 60 days, which is the current limit in Mississippi. After 60 days, most Medicaid patients lose their health care coverage, and this period of time is often most deadly for mothers. Most states, however, have passed measures to extend postpartum Medicaid coverage up to that full year, which is what hopefully Mississippi will have. Because, of course, if the governor changes his mind about signing the legislation, it will become law without his signature. But if he changes his mind and decides that he wants to veto it after he said, if you send it to me, I will sign it, then we have a problem. Because then the legislature will be tasked with overriding that veto if they so choose when they return next year in January. Mississippi opting into the program for this postpartum extension would simply send additional federal funds to the state's division of Medicaid, which would then reimburse health care providers directly for any care they provide to qualified mothers. Now, many politicians have tried to equate Medicaid programs, including the postpartum Medicaid extension, with direct cash assistance in efforts to sow discontent and disinformation among those opposed to more government spending. And I find that awfully interesting because Mississippi has a $3.9 billion surplus, and much of that money came from the federal government because of COVID initiatives and spending. So you don't want to do the right thing by your constituents, but you still want to take the money and just kind of hoard it for your own special pet projects. Now, the question is, postpartum care extension the same thing as Medicaid expansion? And it is not. Postpartum Medicaid extension is not the same thing, despite what some elected officials and candidates have said. Once again, the sowing of misinformation, disinformation, just flat out untruth. The proposed postpartum extension would simply extend the length of time Mississippians who already qualify can access postpartum services. Medicaid expansion, which has never been seriously considered by Mississippi legislative leaders, would broadly cover health care services for hundreds of thousands of additional Mississippians, and that number has been slated around the 300,000. Medicaid expansion, as it's commonly referred to by politicians, is a completely separate issue from postpartum Medicaid extension. And it can save lives, perhaps the life of someone you love. Now, Mississippi has one of the highest maternal mortality rates in the country, and it's getting worse. The state also has the highest infant mortality rate. Y'all, that means the babies are dying. Preterm birth rate and low birth weight rates in the country. Despite these problems, neonatal ICUs and labor and delivery units continue to close, and that in part is because of the failure to expand Medicaid. Despite these problems, the state is expecting thousands more births following the U.S. Supreme Court's decision to overturn abortion rights last summer. Thousands more, but yet we are losing access to maternal care, childbirthing units, obstetrics, because 2/3 of babies born in Mississippi are born to people on Medicaid. Extending postpartum coverage would boost the access to care and health outcomes of thousands of Mississippians, healthcare officials and researchers say. Doctors, nurses, and major medical associations in the state have joined a growing chorus of everyday Mississippians and the legislature calling for postpartum Medicaid extension. And the only reason it has taken as long as it has is because your leaders, who are senators and representatives, are afraid to go against the Speaker of the House and the governor, because the lieutenant governor and the Senate have passed postpartum extension for 4 times, and it has always died in the House, even though a survey shows that the majority of the legislators are in favor of the extension of postpartum care. Mississippians on Medicaid have postpartum coverage for 2 months after giving birth. But regardless of what postpartum needs they might have beyond 60 days, they lose coverage after that. Research shows that the drastic health problems for mothers exist and continue to develop well after 2 months postpartum. Now, we're going to talk a little bit more when we come back in just a moment about how other states handle this.
Welcome to the JMMF's Culinary Kitchen in partnership with Footprint Farms, and funded in part by the W.K. Kellogg Foundation, sponsored by Humana. I am Chef Shishi, the owner of Just in Time, the featured chef of the JMMF Culinary Kitchen, where we prepare farm-to-fork centered, healthier, all-natural foods in the urban community. Our menu includes salads made from collards, kale, and spring mix varieties, fresh vegetarian soups, and fresh juice elixirs made daily. We're open Tuesday through Friday from 11 a.m. until 2 p.m. And remember, what you put in your body is just as important as what you put on your body. We look forward to seeing you soon.
Hi, and welcome back. We are talking about maternal health here during this segment. We're continuing on, and I just want to share that 29 other states have extended postpartum Medicaid coverage for 1 year. 7 additional states are planning to offer the extension pretty soon. States that have already extended postpartum care include our neighbors, Alabama, Louisiana, and Tennessee. Alabama, Louisiana, and Tennessee. Mississippi and Wyoming are the only 2 states that have neither extended postpartum coverage nor expanded Medicaid more broadly. Y'all, why do we always have to be first in everything negative? Though the Mississippi Senate has passed the postpartum Medicaid extension 4 times in 2 years, and most recently this year on February 7th, the legislation has been killed by the House of Representatives. The House Medicaid Committee was thinking about it, and then Speaker Gunn, who is not running for re-election, indicated that he would support it. Don't know what was the mind changer on that, but we are mostly pleased that it happened. Now, there may have been concern because, as I said before, most of the legislators are ready and were ready for extending the postpartum part of Medicaid. Now, Speaker Gunn may have seen the writing on the wall because it is my understanding that the Republicans were caucusing and trying to figure out, how not to offend him, but how to take care of their constituents. And they were talking about the bill. They were having their private caucuses. And when the numbers were not in favor of Speaker Gunn's position, it is my understanding then that he came out. And there was also a letter sent by Drew Snyder, who is the director of the Division of Medicaid, who sent letters to the leadership on or about February 27th and stating his support for the measure. So sometimes, it's good that you can change your mind, even if it's not your personal wish that people are taken care of after they have babies, and change your mind. In this case, the citizens will benefit from this changing of mind by Speaker Gunn as well as Governor Tate Reeves. Statewide organizations and health professionals advocated for the policy change, including the state health officer, Dr. Dan Edney. He is the Mississippi State Medical Association. The Mississippi State Medical Association is one of those organizations, the Mississippi Medical Care Advisory Committee, and the Mississippi Economic Council. Additionally, there was a survey taken by Mississippi Today, and that the members were overwhelmingly pushing for it. Once again, you got to remember, this is an election year, and this can be a positive thing for them to run on. Once again, it's a selfish motive, but at least the people will benefit from this. Recent polling also shows that 2/3 of the states support that measure, and the overwhelming majority are in favor of the expansion of Medicaid, the total expansion of Medicaid, which would cover an additional 300,000 people, which is that number. Now, the economic impact of this passage may be to save some hospitals as well. Officials and advocates have said that postpartum Medicaid extension would result in net savings for the state by preventing costly medical conditions from lack of treatment. Premature babies can cost the state more than $500,000 more than one baby born at term. Did you hear that? One premature baby can cost the state more than $500,000 more than a baby that is born to term. It's estimated that extending postpartum Medicaid coverage in Mississippi would cost about $6 to $7 million a year, which is marginal considering our surplus. Now, who can qualify for postpartum Medicaid? The head of the state's Division of Medicaid, though legislative leaders have long said that Governor Reeves has the power to extend postpartum Medicaid coverage without the approval of the legislature, Governor Reeves did say that he would sign the bill if they sent the bill to him. As of today, or as of late yesterday when I last checked, we are still waiting. But this is one positive. So when you see your legislators who voted for the extension of postpartum Medicaid, give them a big thank you, because this is sorely needed for the health of mothers, the health of babies, and can assist with treating some of the problems that can become long-term and chronic issues. So say thanks. Now, we're going to talk about something else that is near and dear to my heart, and it's passed. As a matter of fact, the governor has even signed it. It is an act created, and it's called the Mississippi Vulnerable Person Abuse Registry. That means that people who abuse vulnerable adults will have to be registered in this registry, and it will be maintained by the Department of Public Safety. Those people who are convicted now, not accused, so don't go calling in on your mother-in-law or your neighbor down the street because you don't like something that they're doing, but anybody who has been convicted of abuse, neglect, or exploitation of a vulnerable person will be maintained in that registry, and it can affect your employment, your living arrangements, and possibly other opportunities in your life if you are abuse, neglect, or exploit vulnerable adults. This is something, in my opinion, that's long overdue. I work with a couple of companies who provide services to seniors, and it is most disconcerting when you do your best in taking care of them, but then you see relatives, friends, whomever, who may exploit. And exploitation is seemingly the biggest area. Mama, daddy, or grandmama may need something, but the person who is taking care of their finances may decide that, oh well, I've got the money, so I'm not going to take care of this need. And they abuse the funds. And by doing so, they exploit the vulnerable adult who can't do anything about it for the most part. And I don't think this goes far enough, because there's no way for the vulnerable adult really to report and still be safe. If they decide they want to report, what are they going to do? That person is their main caregiver, their guardian, or their conservator. They have nowhere to go except back to that environment, back to that space. And what do you think, and how do you think that caregiver, that guardian, is going to treat them now that they've been accused of abusing them or wasting, taking their money without the authority of the vulnerable adult, who sometimes they're very sane, they just are not mobile, so that guardian or that conservator, or just someone who's living in the home with them. It may be a relative, maybe a grandchild, maybe a child, but that's a real problem. And I remember he's no longer in the legislature at this point, but he was trying to come up with some ideas, almost like foster care for seniors. So that if there were problems with relatives or friends, neighbors, whoever is managing the money and sometimes supposed to be taking care of their needs, began to abuse that process, then there could be like a foster care, even short-term or long-term for the seniors, so that they could be removed from that environment while a case is being investigated and a determination being made. Because sometimes it's just a matter of getting that checkbook and getting that credit card, and they just go wild, and there's nothing in many instances left. If there's a need for a ramp, if there's a need for a wheelchair, you would be surprised at how often folk who are supposed to be taking care of seniors won't fulfill those simple needs. And it just goes on and on. So I'm pleased to see that as a one step to take care of that. But there are some, of course, we know, what bothered me about that piece of legislation, though, is that it's confidential. Unlike with sex offenders, when they go on that registry, you can kind of, Google their name, look them up, and see if someone is on that list to verify. But with this, there's a bureaucracy of paperwork and requests for information that you have to go through. And then, y'all, once again, why can't we all just get along? Jackson garbage is back in the news. Your water bill is going to go up. Hopefully somebody will be picking up your trash if you live in Jackson on April 1, because the contract with Richards Disposal is going to expire on the 31st. The mayor says the ruling of the Supreme Court makes no never mind. Thank you for joining Unmuted. We'll see you soon.
Welcome to the JMMF's Culinary Kitchen in partnership with Footprint Farm, the Farmers Hands Markets, and funded in part by the W.K. Kellogg Foundation, sponsored by Humana. I am Chef Shishi, the owner of Just in Time, the featured chef of the JMMF Culinary Kitchen, where we prepare farm-to-fork centered, healthier, all-natural foods in the urban community. Our menu includes salads made from collards, kale, and spring mix varieties, fresh vegetarian soups, and fresh juice elixirs made daily. We're open Tuesday through Friday from 11 a.m. until 2 p.m. And remember, what you put in your body is just as important as what you put on your body. We look forward to seeing you soon.
All right, we're going to try to figure out why we all just can't get along. Y'all, as far as I am aware, and I have called and asked for someone to come on and speak, probably with way more knowledge than I have, about the Jackson garbage dispute that just keeps going and going and going. And all people in the city of Jackson want is for their trash to be picked up. Their trash to be picked up. And I am not aware of trash buildup in the streets and people complaining a lot about the services that they are receiving. Now, facts. The city of Jackson had a request for bids. They got several individuals who submitted a response to that request for bid. They had a blind evaluation process where those individuals who were reviewing the bids that had been submitted did not know the names of the companies. They only had, I'll use here, A, B, C, D bids. At the conclusion of reviewing and comparing the bids with what was requested in the request for bids, Richard's Disposal rose to the top. Fact, his bid would save the city of Jackson $1 million a year over the next bid. Then and he has been servicing other municipalities successfully. He has not been fired. As far as I know, he has not been sued, and maybe somebody can come on and tell us differently, for lack of performance, poor performance in any of those other municipalities. So the mayor then drafts a contract, or his office does. They present the contract to the city council, and the city council says no. Now, it's your process. All of the people who submitted their bids went through the process, and the Richards Disposal bid was the lowest and best. That's usually the standard, lowest and best. The city council refused to go along with the contract. They wanted someone else. Well, that's a little confusing for me. Now, I've listened to a lot of press conferences and interviews with the media, but I haven't really heard reasons why Richards is unacceptable and why the contract should not be approved by the council. Hadn't heard any of that. All I have heard is, we want somebody else. We want vendor 2 or vendor 3 or the next vendor. Those are the words being used. But why? If Richards Disposal is saving the taxpayers of Jackson $1 million a year, what is the problem? And is it not one that can be resolved through negotiation with the contractor who won the bid, Richards Disposal? I heard something yesterday or this morning from one of the council members who said they wanted roll-off dumpsters. Okay, if that's a deal breaker, then have a conversation. But my question is, was that part of the request for proposals? Was that something that was required of all of the bid responders, that you had to have roll-off dumpsters or roll-off garbage? If that was the case, then Richards and others didn't fulfill all of the requirements for the bid. But if Richards and vendor 2 and vendor 3 and all of the others didn't have roll-off dumpsters. I don't understand why that wasn't part of the bid request. And if it wasn't, why are you trying to hold Richards' disposal to do something that you didn't ask them to do or present funds? I'm just perplexed by, we're paying money, and keep in mind, in full disclosure, I do not live in Jackson, but I spend much of my time in Jackson. I have a son that lives in Jackson, and I patronize Jackson. So I have a concern about the garbage as well, and paying taxes in Jackson. But I don't understand how you're not going to have to pay Mr. Richards on the front end or the back end. Because if we go to vendor 2, what is our reason? Has Richards been delinquent, derelict in their performance of the contract? Or have they sent their folk out there and they've picked up the trash at the times or the days that they said they would, except maybe for holidays like they do in most other places? You know, if a holiday falls on a Monday, then your trash may be picked up on Tuesday. You know, everything just pushes out a day. That's not unusual. I haven't read the Richards contract, but I do understand procurement and bidding, and this just, it don't smell right. That for whatever reason, because like I said, I haven't heard any reasons other than we just don't want them, for not allowing them to perform without all of this trauma, and I'm sure emotional distress and financial gains, because it took them over 6 months to get their first payment. Well, he was still running trucks. He was still paying his people to pick up that trash and incurring legal expenses. So the city of Jackson is going to have to come to that legal table at some point. And if they try to take the contract away, because he's under an emergency contract now, if they say, well, your bid didn't meet the specifications, how did he come out on top in a blind process? So then the city of Jackson is going to be sued, and all kinds of contract issues are going to come up, and they're going to end up having to pay Richards for work maybe that they can sit on the beach after March 31st and just let the city of Jackson continue to dig this hole for themselves. Now, we can't leave this why can't we all just get along time without talking about the water, because Mr. Hennepin is trying to figure out the billing for the city of Jackson. And he had agreed to come on and talk to us about it. And I had a conflict with that time. So we've not been able to get back on track to get him into the studio because the legislature has kept him pretty busy. He thought his task was to drain the swamp, but he's been fighting off alligators up there. But of course, Mr. Ted Hennepin is the federally appointed third-party Jackson Water System Administrator. Look for your water bills to go up. I think they have been putting in meters. I don't know if that process is complete just yet. He has been engaging in the community at town halls and question and answer sessions, and I applaud him for that. But of course, the Jackson water system did not get in this shape overnight, and it's not going to be fixed overnight. That's why the federal judge said for him to come in here, and then they'll reassess the situation in 5 years. The legislature did back off trying to set up this regional water system that they were talking about, because someone must have told them that you're going to spend millions of dollars on a lawsuit that you really don't need to get into at this point, especially when the process with Mr. Hennepin has just begun, laying the foundation, trying to get some folk in place who actually are trained and educated in how to manage that water plant, how to manage the water system, how then to do the billing. And there's a lot of controversy about that. Mr. Hennepin's proposal initially is that you would be billed on the value of your property, not on your use rate. And yeah, I've got mixed feelings about that, but of course I don't get a vote in the decision. They collected $5.3 million in December, which was a good amount, and $4.7 million in January, but it's still not where the collections need to be. Apparently, a lot of folk are stealing water. They may be running a faucet from an empty house into their house, or someone that they may have a connection has turned the water on when the water really should be off. But I am a little concerned about having to pay for based on your value, because if you have two properties, one that may be vacant for whatever reason, and then you are paying for the value of both of those properties on water when you're not using water at least one of those properties. And then there's been a flat rate fee versus a meter billing fee. So the ideas are out there, and hopefully in time that will all come together, and everybody is not going to be happy, but at least perhaps you will have some idea what your water bills are going to be. And then they have the program where those people who had delinquent water bills as of December of 2022 could apply for some assistance. So if you haven't, you need to check with the city and apply, even though they are pulling money from a fund that wasn't the original place that it was going to come from. The plan for the water rates is one, though, that they're discussing about having a cap on that, no more than $150 per month for homes with a value of $160,000 or more. And he said the current average rate of a water bill is about $50 a month for most people in Jackson. That doesn't seem too crazy and too wild, but I'm sure that there is going to be an effort to work through all of those things. And hopefully within 5 years, the system can be fixed and working and trusted, because Jackson is losing a lot of businesses. And a friend of mine and I were talking the other day, we can't think of anybody who has come into the city in the last 5-6 years making jobs and creating jobs for individuals to work at. They're going to the neighboring suburbs, and that may be by design as well. Sometimes people are plotting and planning when we are asleep and thinking everything is going all right. We'll continue with this Why We All Just Can't Get Along with so many other things, because I want to talk about CCID, but I'm going to devote a whole show to CCID. Let's hope, impact, and influence your legislators on the funding of public education if you so will. Just call, and tell them you hope that they will support it. We are going to be out of here in a little bit. I'm sure I've missed something. But watch the people who you have to elect and how they are voting and what they are doing, because many of them are all about their own selfish desires and not about the needs of the citizens of Mississippi or Jackson. Thank you so much for joining us. You're listening to Unmuted.